Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Parathyroid disorders. Introduction. Most people have 4 tiny glands called parathyroid glands close to the thyroid gland in the neck. The parathyroid glands make a hormone that helps your body keep the right balance of calcium and phosphorus. If your parathyroid glands make too much or too little hormone, it can cause many health problems. Treatment can help restore the balance of calcium and phosphorus in the body. This program explains parathyroid disorders, including hyperparathyroidism, hypoparathyroidism, and cancer. It covers symptoms of these disorders as well as treatment options. The parathyroid glands. The parathyroid glands are pea-sized glands. They are located close to the thyroid gland in the neck. The thyroid is a gland located at the front of your neck. It sits beneath your voice box, also called the larynx. The thyroid has 2 parts and is shaped like a butterfly. These parts are called lobes. The isthmus is a piece of tissue that separates the 2 lobes. Though their names are similar, the thyroid and parathyroid glands are completely different. Parathyroid glands are attached to and behind the thyroid. Each person has 4 or more of these tiny glands. Parathyroid glands make parathyroid hormone. Parathyroid hormone is also known as PTH. PTH controls the amount of calcium and phosphorus that is stored in the bones and moved throughout the blood. It also tells the kidneys to either hold onto or release calcium. PTH works with vitamin D to control how much calcium the body absorbs from the food we eat. Calcium is needed inside just about every cell in the body in order to keep that cell working properly. When the blood level of calcium is too high or too low, bad things can happen. It may even be life-threatening. Symptoms. Many parathyroid disorders have similar symptoms. The main symptom is feeling very tired. These disorders can also cause weakness. Other common symptoms of parathyroid disorders are being very thirsty and urinating much more than usual, constipation, loss of appetite, nausea and vomiting, trouble thinking clearly or memory loss, weight loss for no known reason. Some parathyroid disorders may also cause a broken bone, a lump in the neck, dry hair and skin or brittle nails, pain in the bones, muscles, abdomen, side, or back, a tingling feeling in the lips, fingers, and toes. Talk to your healthcare provider if you notice any of these symptoms or other changes. Finding a problem early makes treatment easier in most cases.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Hyperparathyroidism. If your parathyroid glands release extra PTH, you have hyperparathyroidism. High PTH levels trigger the bones to release increased amounts of calcium into the blood. If blood calcium levels are high, it is called hypercalcemia. This can affect many parts of your body and cause abnormal heart rhythm, confusion and other nervous system problems, kidney problems, weakened bones. There are many possible causes of hyperparathyroidism. In many cases, a benign tumor on a parathyroid gland makes it overactive. In some cases, the parathyroid glands may become enlarged. Enlarged parathyroid glands may release extra hormones. The cause of hyperparathyroidism may also be cancer, but this is rare. Sometimes the body doesn't have enough vitamin D or calcium, or it has trouble absorbing them. Since there is not enough usable calcium, the parathyroid tells the bones to release more. This is another possible cause of hyperparathyroidism. Chronic kidney failure may potentially lead to hyperparathyroidism. Treatment for hyperparathyroidism may include monitoring, medicines, surgery. Some people who have mild hyperparathyroidism may only need to be monitored for changes if they do not have any symptoms, have only slightly higher than normal blood calcium levels, have no kidney problems, have normal bone density. Sometimes medicines may be used to treat hyperparathyroidism. In many cases, surgery may be needed to remove the overactive parathyroid glands. Surgery cures more than 95% of hyperparathyroidism cases. Hypoparathyroidism. If you do not have enough PTH, you have hypoparathyroidism. This causes the blood to have too little calcium and too much phosphorus. Causes of hypoparathyroidism include injury to the glands, endocrine disorders, genetic conditions, low magnesium levels. Surgery near the parathyroid glands may injure them. Often, surgery near the parathyroid glands includes surgery on the thyroid gland, surgery for throat or neck cancer. Sometimes the parathyroid glands are not present at birth or they do not work properly. Another possible cause of hypoparathyroidism is autoimmune disease. In this condition, the immune system mistakenly attacks the parathyroid glands. The glands then stop making PTH. Radiation treatment may also cause hypoparathyroidism. Radiation treatment for head and neck cancer or radioactive iodine treatment for an overactive thyroid may harm the parathyroid glands. Lifelong treatment can manage hypoparathyroidism. There is currently no cure for hypoparathyroidism. Once the parathyroid glands are injured or removed, they cannot be replaced. Treatment for hypoparathyroidism focuses on restoring the body's calcium and phosphorus levels to normal. This is often done using supplements. Supplements of vitamin D, magnesium, and calcium may be given to help treat hypoparathyroidism. Diet changes may also be recommended. You may need to limit foods high in phosphorus, such as soft drinks. You may be told to eat foods high in calcium, such as breakfast cereals, calcium-fortified orange juice, dairy products, green leafy vegetables. Talk with a dietitian to learn more. Some people may receive hormones if diet changes and supplements are not enough. Discuss the risks and benefits with your healthcare provider. Cancer. Cancer begins in your cells, which are the building blocks of your body. Normally, your body forms new cells as you need them by replacing old cells that die. Sometimes this process goes wrong and a tumor forms. If a tumor is cancerous, cells from the tumor can invade other tissues throughout the body. Cancer cells can spread to different parts of the body through blood vessels and lymph channels. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the parathyroid glands will always be called parathyroid cancer. This is true even if it is spread to other places in the body. Cancer in the parathyroid glands can cause extra PTH to be released, resulting in the calcium stored in the bones moving into the blood, the intestines absorbing more calcium from the food we eat. Having too much calcium in the blood is more serious and life-threatening than parathyroid cancer itself. Treating the high calcium levels in the blood is as important as treating the cancer. Having certain inherited disorders can increase the risk of developing parathyroid cancer. These disorders include familial-isolated-hyperparathyroidism, or FIHP, multiple endocrine neoplasia type 1, or MEN1 syndrome. Treatment may involve surgery, chemotherapy, radiation therapy.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Most people have 4 tiny glands called parathyroid glands close to the thyroid gland in the neck. The parathyroid glands make a hormone called PTH that helps your body keep the right balance of calcium and phosphorus. Many parathyroid disorders have similar symptoms. The main symptom is feeling very tired. These disorders can also cause weakness. Other common symptoms of parathyroid disorders are being very thirsty and urinating much more than usual, constipation, loss of appetite. If your parathyroid glands release extra PTH, you have hyperparathyroidism. High PTH levels trigger the bones to release increased amounts of calcium into the blood. If you do not have enough PTH, you have hypoparathyroidism. This causes the blood to have too little calcium and too much phosphorus. Cancer in the parathyroid glands can cause extra PTH to be released, resulting in the calcium stored in the bones moving into the blood, the intestines absorbing more calcium from the food we eat. If your parathyroid glands make too much or too little hormone, it can cause many health problems. Treatment can help restore the balance of calcium and phosphorus in the body. Treatment may include medicines or surgery.
Thank you for using Explain.